As we age, we tend to lose muscle strength and our bones become thinner. And if we fall, we're subject to fractures, particularly of the hip, back, and forearm. If we can't see where we're going, it ups the ante and it makes it easier for us to fall. And if we have a cataract, that's one of the major factors that leads to falls and fractures. A cataract surgery is one of those amazing surgeries that has a very high success rate. I know because I've experienced cataract extraction and lens implantation myself. Mine happened to come from an injury. I was hit with a tennis ball. I guess I was watching the ball too closely, and it went right into my eye, and it caused damage to the back of the eye. And over a period of about 20 years, a membrane grew in the back of that eye and led to my not being able to see the E on the chart. So I figured it was time to have that thing peeled off and see if we could restore vision. And indeed it did, back to about 2020. And as a complication of that surgery, I developed a cataract. And again, about a year later, I couldn't see the E on the chart, and I decided to have that fixed. And that was in 1998. This is 2012. I still have close to 20/20 vision. And my stability is much improved. It's sort of like somebody washed the windows, brightened up the lights so I could see, and it makes a big difference in quality of life. A study was done on about 1 million seniors, of which 14,000 had a hip fracture over about 7 years. The incidence of fractures in the group that had a surgical procedure for their cataract was 1.3%. When you look at the numbers of 1 million people, 14,000 fractures, 1.3% is a significant number. And in that group that didn't have surgery, there was a problem with a fracture 16% of the time more often. It also helps prevent other things from going wrong as well, things like auto accidents and other things that require balance and strength. Our ability to exercise in sports goes way down. You can see a big difference in the age gaps in senior sports of all different types. So the question about when do you have a cataract extraction comes up. When are you ready to do that? When you can't navigate safely, maybe you can't drive safely, maybe you're at risk for falling, it's time to think about it, because this operation in the hands of an expert takes about 20 minutes. 20 minutes. It's a light anesthesia, and the results probably 97% of the time are stellar. Quality of life becomes a real big deal. My nurse Vicky also had a couple of cataracts done just in the last couple of months, and she went from not being able to see to read her computer without really magnifying the numbers to now seeing a fly at 50 yards. It's amazing how much good that did. So a lot of it depends on how you feel about how you see and how much risk you want to take. I never recommend doing an operation unless the benefits are going to be greater than the risks, and that's why I waited so long for mine. So cataract surgery is a good idea if your vision is compromised, if you particularly have weak bones, if you're subject to falls, because once you get that fixed, your quality of life is better, your risk for falling goes way down, and chances are you'll live a life that is filled with good sight and with safe bones.